Welcome back to Nurse Career Blueprint, where we break down complex nursing concepts into explicit test-ready knowledge. Today, we're diving into a topic that confuses many NCLEX test takers: heart failure versus pulmonary edema. They're connected, but they're not the same. Knowing how to spot the difference, how to understand the pathophysiology, and how to identify key nursing interventions could mean the difference between a correct and incorrect answer on the NCLEX. Let's get into it. Why? This topic matters. The NCLEX often tests conditions that appear similar, sound similar, or are related, but require different interventions. Pulmonary edema is a complication of heart failure, not a type of heart failure. So if a question asks about a patient with frothy pink sputum or crackles in the lungs, you need to know, is this worsening heart failure or is it full-blown acute pulmonary edema an emergency? What is heart failure? Heart failure, HF, is a chronic condition where the heart is too weak to pump blood effectively. Two types of heart failure, they are left-sided heart failure and right-sided heart failure. In left-sided heart failure, blood backs up into the lungs, which can lead to pulmonary congestion and pulmonary edema. Signs and symptoms include dyspnea, orthopnea, crackles, fatigue, and cough. Right-sided heart failure. In the right-sided heart failure, the blood backs up into the systemic circulation. Signs and symptoms include peripheral edema, jugular vein distension, ascites, hepatomegaly. Check out this NCLEX tip: left equals lung, right equals the rest of the body. What is pulmonary edema? Pulmonary edema is the sudden buildup of fluid in the lungs. It's a life-threatening emergency, often a complication of left-sided heart failure. Think of it as heart failure in crisis mode. The heart isn't just struggling now, it's failing badly enough that fluid is flooding the lungs. Classic signs include severe dyspnea, especially when lying flat, orthopnea, pink frothy sputum, crackles all over the lungs, feeling of drowning or suffocating, tachycardia, anxiety, cyanosis. Pathophysiology review. Here is the chain reaction: left-sided heart failure. There is decreased cardiac output. The blood backs up into the pulmonary veins. The increased pressure in the lungs leads to the fluid leaks into alveoli, consequently leading to pulmonary edema. Pulmonary edema is not gradual, it's sudden, and it requires urgent action. NCLEX style question breakdown. Here is the question. A client with a history of heart failure presents to the emergency room with severe shortness of breath, orthopnea, frothy pink sputum, and oxygen saturation of 82%. What is the nurse's priority intervention? A. Administer IV Lasix. B. Administer oxygen via a non-rebreather mask. C. Obtain a chest X-ray. D. Place the patient in a flat position and notify the provider. Answer. B. Administer oxygen via a non-rebreather mask. Rationale. This patient is experiencing acute pulmonary edema. The immediate priority is oxygenation. While diuretics such as Lasix and diagnostics such as X-rays are appropriate, know that ABCs come first. Placing the patient flat would worsen breathing. The NCLEX loves the ABC priority framework: airway, breathing, circulation. Nursing interventions: heart failure versus pulmonary edema. For heart failure, especially chronic, include the following: daily weights, monitor intake and output, low sodium diet, fluid restriction as ordered. Medications include ACE inhibitors, beta blockers, diuretics, and digoxin. The patient education includes rest, diet, and tracking of symptoms. For pulmonary edema, this is an emergency. Think LMNOP, the nursing acronym, which stands for the following. The letter L for Lasix, IV diuretic. The letter M for morphine, vasodilator, reduces anxiety, workload. The letter N for nitroglycerin, vasodilation to reduce preload, afterload. The letter O for oxygen, high flow or non-rebreather mask. The letter P for positioning, high Fowlers to maximize lung expansion. This patient may need ICU care, CPAP, or even intubation depending on severity. Memory tricks, left to right lung. An easy way to remember left-sided heart failure is that it leads to lung congestion. Pink, frothy sputum, pulmonary emergency. If you see this phrase, think acute pulmonary edema. Final NCLEX. Tips: don't mix up the diagnosis. Pulmonary edema is a result of heart failure but needs urgent care. Focus on priorities, oxygen, positioning, and rapid meds. Understand fluid management, know when to restrict and when to flush. Apply ABCs to every acute scenario. Recap: know the NCLEX difference. Heart failure is a long-term chronic condition. Pulmonary edema is a sudden life-threatening event. Don't let the overlap confuse you. Know the distinct signs and nursing responses. If you found this video helpful, don't forget to like, comment, and subscribe to Nurse Career Blueprint. We're here to help you not just pass the NCLEX, but pass with confidence. Download a free NCLEX Ultimate Study Guide at nursecareerblueprint.com. Stay ready, stay confident, you've got this.